Hi, this is Dr. Satish Pawar, Senior Surgical Oncologist and Head of Department, Care Hospitals, Hyderabad. So, today let us talk about ovarian cancer. So, ovarian cancer is nothing but a cancer in the ovaries. So, ovaries are located on both the sides of the uterus. So, it is this cancer has generally two types of presentations. One in an younger age, which is called a germ cell tumor, which is generally present below 20-25 years of age in the teenage age group also. And the typical cancer, the ovarian cancer, presents above the age of 40 years of age. What are the common symptoms of ovarian tumor or a cancer? So, generally, people present with bloating and excessive acidity or gas formation, that is commonly called discomfort or fullness after having food, and in late stages you might have weight loss or loss of appetite. So these symptoms are very generalized symptoms, and we ignore these symptoms by saying that it can be just some gaseous issues. So we take commonly, even if you go to any general practitioner, they'll prescribe some antacids and some painkillers, and that is it. So we ignore these symptoms, and most common presentation, 80% of the times, this cancer presents in stage 3 or stage 4. Once it is already spread in the abdomen, this cancer generally presents. So for early detection, it is always necessary to get ultrasound of the abdomen yearly once and tumor markers above the age of 40 years. Once detected, this cancer generally, if it is in the first or the second stage, we do not recommend any biopsy based on the radiological investigations, and most commonly we should get either a MRI or a CT scan done, and MRI is preferable because of better soft tissue delineation, better understanding of the tumor. Once it is detected in first or second stage, we just generally go for only surgery. We remove that mass along. Then if you are above the reproductive age group, that means if you already have children or if you are in a postmenopausal age group, then we remove the uterus and the other ovary and those areas where the cancer generally spreads, that is the omentum and the peritoneum. So these biopsies are done, and the lymph nodes. So once the final stage comes, if it is a high grade tumor or if it is beyond stage 1B, that means we give chemotherapy. So what we do is we give chemotherapy, reduce the size of the lesion, and along with that the spread also comes down. The patient starts feeling hungry, the patient gets better, and then we do surgery and remove the entire mass and along with the deposits wherever they are there in the abdomen, and followed by the rest of the chemotherapy. In an inoperable setting, that means if it is already spread to other parts of the body such as liver, lungs, brain, bone, so what we do is we give chemotherapy along with immunotherapy or targeted therapy. So most commonly these patients present with lot of lymph nodal disease as well, saying if the lymph nodes go above the abdomen into the chest in the mediastinum or in the neck, then it is in an inoperable setting where only chemotherapy, targeted therapy and immunotherapy works. Thank you.